you to imagine having to relearn living your everyday life when the world is going on like nothing has happened. Welcome to Diagnosis and Beyond. I'm your host, Angel Marie Carson. I'm a speech-language pathologist, a 16-year brain cancer survivor, and a mom. Today, I want to share something real, what occupational therapy actually looks and feels like to a neuro patient, and how it ties into speech therapy. They're a team. Occupational and speech therapists work as a team, especially in the rehab setting. They all meet once a day to talk about all the patients in the rehab. So they work closely together. Okay, so this is an example of what they did. It wasn't just exercise in the clinic. They would take the neuro patients out every other day into the real world to simulate what it would be like for the neuro patient once they get home. Some of the situations that are going to come up are going to be, it's just imperative for the neuro patients to experience that pretend environment actually, but you going out into the world. So for example, we went bowling. They took all the neuro patients bowling. They took us in a bus. And even the traffic getting there was chaotic and noisy, and the horns are beeping and the lights are flashing and it's bright outside, and it's all of that is stimulation to the brain that's still trying to heal. So it was really overwhelming. The OT, took us bowling, the lights, the movement, it was too much stimulation overall. The next day we went to the cafeteria. All of us neuro patients got in the elevator. It was 2 floors down. So we went into the cafeteria. The goal was to order food independently. It seems like a simple task, but when you're a neurological patient, it can be challenging. So they took us down, and it was anything but easy. So they took us down to the cafeteria. My husband came because he was always trying to be supportive. He got pretty good at reading my gestures, so he knew, when I sat down, there was a line that you had a tray, and you could see the food, so you would just pick what you wanted. I picked French fries, and we went into the cafeteria, sat down at the table. I took them off the tray, and I pointed at them, and he said, "Oh, you want ketchup?" And I nodded yes. So he said, "Okay." So he calls over the waiter, and he says, "Tell him what you want." I said to myself, "What? I can't even tell you what I want, and you want me to tell a stranger what I want?" So I got frustrated. I just got up and got it myself. And the next day, I had a very poignant conversation with my speech therapist through pen and paper. I told him, I said, "You've got to educate my husband because I'm afraid to go home with him." And so that's where the occupational therapist highlighted, even though I knew that was the case, but that was just so obvious when he put me on the spot then to speak. I mean, I know that he's a businessman, and I know that he can be curt, but that was not okay. But that's an example of the OT putting me in that situation so then I could tell my speech therapist exactly what had to be done in order for me to feel secure to go home. So that was a planned adventure for my OT, for our patients to go down and be with their family or not be, just to highlight that the family needs education. So I told my therapist that when you go home, that's when the real test begins. Therapy can teach you skills. Doctors can give instructions. Therapists can build confidence, as my speech therapist built so much confidence in me by the way he treated me, which was, he just talked to me like nothing had happened. But when you go home, your family becomes the environment you have to heal in. And the environment can either help you keep progressing, or it can make you feel like you're failing every single day. Sometimes families just want things to go right back the way they were before, especially young families. I mean, I was only 41. My children were in 3rd and 4th grade, so we had a young family. And there were routines, kids' activities, bills, stress, responsibilities, and he just wanted us to go back to normal. But we had a new normal. Our normal had changed. And when one partner is willing to learn, but the other partner keeps expecting everything to go back immediately, that can break a family apart. Not because there isn't love, but because there isn't understanding. One person is fighting to recover, and the other person is fighting to get life back the way it used to be. And it's not going to be that way for a very long time, or a long time, but they have to be patient. You know, they have to pay attention to eye gaze, pay attention to gestures, you know, maybe have a core board at home with their favorite things on it so that you know what they want. You know, it's just a lack of understanding, but it can mean everything to that patient that's going home. You know, it's going to affect their self-esteem, and when your self-esteem is low, forget it. You're not going to progress. Progress is going to halt. So it can make you feel smaller. It can make you feel scared. It can make you be afraid to try. That's why families have to be educated, because real progress at home depends on whether the people around you understand what recovery actually looks like. And that's what's important about when you work with families, even if you work with kids, you speech therapists out there, and occupational therapists. You guys know you have to educate the families. That is pivotal. Because we're only with the patient for 30 minutes or 45 minutes if you do it in the school setting, or even if you're in private practice. But in rehab, it's just they're a team, and they all meet to talk about their patient. So it was me, and I was afraid to go home with my husband, and because he wanted things to go right back to normal. Anyway, so this is what's important about this video, is how occupational therapy put me in a real life situation that scared me about my caregiver going home, that then I talked to my speech therapist about educating my husband. So next time, I'm going to talk about how my speech therapist, got me to talk again. So that's exciting. I like that he just treated me like nothing had happened, even though I had this big gauze on my head. So anyway, I'll see you next time. Thank you for joining Diagnosis and Beyond. I'm your host, Angel Carson, and I look forward to seeing you at the next video. Okay, thank you. Have a good night. Bye.